The Zika virus was first discovered in 1947 and is named after the Zika forest in Uganda. It was originally found in monkeys in the tropical rainforest. From the rainforest, it was passed to humans through infected mosquitoes. Once a human is infected with the virus, it can spread from person to person. A mosquito can carry the virus between people, or the virus can spread through a blood transfusion or through sexual contact with an infected person. The illness is usually mild, and people usually don't get sick enough to go to the hospital. People very rarely die of Zika. The virus can also spread from an infected mother to her unborn child. A Zika infection during pregnancy can cause severe brain damage and other birth defects in the unborn child. As of May 2016, there have been less than 500 cases of Zika virus disease in the United States. None of these cases started in the U.S. Everyone who currently has it was infected in another country before returning home. The Center for Disease Control believes that it is unlikely we will see a large Zika outbreak in the United States, but the virus is expected to appear in warm urban environments as temperatures rise.